PRP or platelet-rich plasma is a really useful adjunct in any aesthetic treatment toolbox. You have to advise the patient appropriately about how PRP works because it doesn't have an immediate effect. You won't see a result within 2 weeks, but you certainly will see improvement in the skin laxity and the smoothness of the skin after about 2 months. Patients have to be patient when they have PRP. It's important to understand the process is harnessing your body's own healing potential. So if a patient has poor platelets or is in bad health or is a smoker, they're not going to be as responsive to PRP as a healthy, fit young patient. So the younger you are, the better results you're going to get from PRP and the more likely you're going to stop the clock moving forward. So we do try and encourage a lot of our patients, particularly the millennial generation, to start PRP treatments from the age of late 20s onwards. Particularly if they're starting to see things like dark eye circles, that sort of skin laxity, perhaps if they've got some acne scarring, if they're worried about the turkey neck that we all get as we get older. They're all good indications for PRP, and the best thing about it is it does no harm. Unlike treating under eye areas with filler, it's much more successful in terms of the improvement to the aesthetics as well as it's safe. You're not going to get into any problems with in causing a vascular problem with PRP. I think there's no late stage to start it. I've used PRP in patients as old as 70 and still got results, but obviously the older you are, the results are going to take longer to see and you're probably needing repeated treatments. Extremely sun-damaged, papery skin is going to need more treatments of PRP than a young person with good texture and tone to their skin. So you have to be really important to educate the patients and explain to them how it works and how long it takes to work. If a patient was presenting for the first time with PRP, we'd probably advise them to have it repeated after a month to get the maximum results and then to undergo repeat treatments once a year to keep the momentum going. I think it's important to engender some trust with the patient along their aesthetic journey, and it's quite a daunting prospect to have PRP done. It involves taking blood, obviously. You're in the surgery for up to an hour, you get a lot of bruising, and there's a lot of needles going into your face. So if you've got a patient who is a bit needle phobic or doesn't know you that well, it's not a good idea to start with PRP straight off. Build up to doing PRP so that you've got the patient on your side and they can see the effects.